Gentlemen, when men are at the doctor and they hear the words digital rectal exam, they immediately think, I don't want a finger in my butt. That's just for checking the prostate, and it's going to be really uncomfortable. But here's what we need to know. A digital rectal exam can actually give us critical information about your pelvic floor muscles, and in some cases, it can even help treat the symptoms on the spot. So today, let's break this down. Do you actually need one? What are we really assessing? And how uncomfortable is it? I'm Junichi Swope, a men's pelvic floor physiotherapist, and a digital rectal exam, or a DRE, is a clinical assessment tool where a trained provider uses a gloved, lubricated finger to assess structures through the anus. Most people associate this with assessing the prostate, but in pelvic floor physiotherapy, we're also assessing something else: the muscles deep inside your pelvis. From inside the rectum, we can actually assess multiple layers of the pelvic floor. This includes parts of the levator ani, such as the puborectalis, pubococcygeus, iliococcygeus, and we can also assess other structures, such as that external anal sphincter, the obturator internus, and contributions from muscles like the bulbocavernosus. And what we're feeling for is tone. Are the muscles overactive or underactive? We want to know if there are tender points or tight bands, and about the coordination strategy. Can you contract and relax properly? Doing a rectal exam can provide us with great information that we can't always get externally. This is especially helpful if you're dealing with pelvic pain or pain with sitting, pain with erections or ejaculations, problems with urinating, or difficulties relaxing the pelvic floor altogether. It helps us answer, is this a muscle problem, a coordination issue, or something driven from the nervous system? And here's something that most people don't know. A digital rectal exam can also be used as a treatment technique. If we find tight or overactive muscles inside the pelvic cavity, we can apply gentle, sustained pressure and help those muscles relax. We reduce sensitivity and guarding, which can help with that muscle hypertonicity, meaning muscles that are in a constant state of staying on. And if you do have a DRE in physio, here's what it typically looks like. You'll be first fully informed, and you have to give consent that you're okay with this. You're usually in a side lying or supine position, and the exam is slow, controlled, and based on your comfort. At any time, you can say, no, I don't like this, let's stop, and it should always feel safe and controlled. Now, if a digital rectal exam isn't something you're entirely comfortable with, there are alternatives. And one of the best options that we use is a real-time ultrasound over the perineum. This allows us to visualize things such as the anorectal angle, which is a measure of how tense your pelvic floor might be, and how your pelvic floor moves when you contract and relax, and contraction tests that reveal the strength, endurance, and recruitment strategies of these muscles. It's completely external, less invasive, and it sometimes gives us all the information that we need to know to address your problem. So the question you may be asking, is every pelvic physiotherapist going to do a rectal exam on me? Not always. Every physiotherapist has different training, and if you find one in your area that utilizes real-time ultrasound, you may not even need one. But in many cases, especially with persistent pelvic pain or tension, it can be one of the most direct and effective ways to understand what's going on. And sometimes it's the fastest way to improve your symptoms. If you like my content, please feel free to hit that like and subscribe button so we can keep showing this to more men who might need to see it. And with more people watching my stuff, Panko here can eat better dog food. It's my 13-week-old puppy. She's a sweetheart. Right, Panko? Thanks for watching.